Hi, my name is Leanne Wendt, and I'm here to do my presentation for the Module 3 assignment. And the title of my presentation is Core Determinants of Health and Target Population. And the objectives of this presentation is we're going to discuss stats of cold, flu, and other easily spread infections in Scotland, where I'm actually living right now. And I wanted to add in that I'm going to discuss pneumonia too. It turns out flu and pneumonia have a pretty broad effect on the people of Scotland. We're going to discuss the core determinants of health, and I call it a wheel. We're going to discuss the relevant determinants in my population that I've targeted, and then I'm going to discuss the expected outcome of the project, specifically addressing these determinants. Stats for 2017 of flu and pneumonia in Scotland. I couldn't really find a dependable source with stats on these infections. Specifically for those that were hospitalized. But I did find the number of deaths attributed to these infections. So in 2017, there were 23,137 deaths between December 2017 and March 2018, according to the National Records of Scotland. And this is the highest figure since 1999-2000, the winter of those years. With these deaths, the number of quote unquote additional deaths in the winter, and that number is 3,860, was 75% greater than 2016 and 17. So there's a problem here. And they found out the problem was the underlying causes of these deaths were influenza and pneumonia. And the average of age of those deaths were among people 75 years and older. So it's in the vulnerable population. So the core determinants of health wheel. I found a rather lengthy report from the World Health Organization describing in depth the core determinants of health, and they make clear that many factors actually combine together to affect the health of individuals and communities. So whether people are healthy or not, it's determined by their circumstances, environment, not necessarily their biological makeup. To a large extent, factors such as where we live, the state of our environment, genetics, our income and education level, and our relationship with friends and family all have considerable impacts on health. Whereas the more commonly considered factors such as access and use of healthcare services often have less of an impact. I found that very interesting, especially when they said our relationships with friends and family have an impact on our health. That's something to think about. So the determinant of health includes the social and economic environment, the physical environment, and the person's individual characteristics and behaviors. The context of people's lives actually determine their health, and so blaming other people for having poor health or crediting them for good health is inappropriate. Individuals are unlikely to be able to directly control many of the determinants of their health. These determinants, or things that make people healthy or not, include the above factors: the social economic environment, the physical environment, and person's individual characteristics and behaviors. Okay, so moving on to slide 4 or 5. My target population are the members of my congregation, and I'm actually a member of the Church of Jesus Christ of Latter-day Saints, and we're commonly referred to as Mormons, although our prophet doesn't want us to call ourselves that. That is the commonly named term. And there's of the approximate 160,000 members of my church in the UK, about 5,500, possibly more, live in Scotland. And of those 5,500, only about 150 of those people live in Perth, Scotland, where I'm currently located with my husband while he finishes an assignment for Boeing. These people here have access to what they call the NHS, and that stands for National Health Service, and it refers to a government-funded medical and healthcare service that everyone living in the UK can use without being asked to pay for the full cost up front. So I've actually used this service when I had a situation with a cyst in my ovary. And so everything, when I went to the emergency room and got medication, it was all free, quote unquote. We are paying for it with taxes, but moving on. So the services for the NHS include visiting a doctor or nurse at a doctor's surgery, getting help and treatment at a hospital, seeing a midwife if you're pregnant, getting urgent help from healthcare professionals working in the ambulance service if you have serious or life-threatening injuries or health problems. And this includes being transported to the hospital if you need that. So people often refer to these health services free at the point of use. What this means is that any UK resident can go to the doctor who will offer diagnosis or treatment for an illness without asking the individual to pay for this service during or after the visit. Instead, most healthcare services are publicly funded, which means money has been allocated by government to pay for this visit to the doctor. And since my husband works here in Scotland, wouldn't you know it, he is also paying taxes in Scotland. And so he pays about 12% of his salary into this service, the NHS. And so we've been able to get our teeth cleaned. And so it's pretty cool. But there are problems. So, with that said, the NHS affects almost every determinant in my population. Um, so, I'm going to carry on because I'm running out of time. Expected outcomes of my project is what I'm doing is I'm presenting a project on how to properly clean your hands and the whys and the wheres and the who's and the what's and my goal is my audience will verbalize understanding of germ transmission, and my audience will verbalize understanding of importance of proper hand hygiene, and they will demonstrate proper hand hygiene. And I'd like to add they will understand how germs are spread. And so after this, we'll be making a bottle of handmade foaming soap to take home with them. It's a take-home project or a product so that they can be reminded and make it fun. So that's my presentation, and it's a little bit longer than 7 minutes, but I hope you enjoyed it. Thank you.